Hello and welcome to our show, Health and Wellness, Myths versus Facts about pre-diabetes. I'm Gargi Rawat. Now, the number of individuals affected by pre-diabetes is increasing rapidly across the world. The presence of pre-diabetes does not mean you have diabetes, but provides you with an option to take corrective action to reverse the condition and prevent the progression to full-blown type 2 diabetes. Pre-diabetes is a serious health condition. Individuals with pre-diabetes are at high risk of developing full-blown diabetes and its associated complications. So a better understanding of it can help with early detection and therefore allow earlier intervention and potentially lower the number of individuals who go on to developing type 2 diabetes. Getting detected with pre-diabetes provides one with a window to take corrective steps to reverse the condition. So to tell us more about this, today we have with us eminent endocrinologists who can help you understand and manage pre-diabetes better. We're joined by Dr. Mala Dharmalingam, a Director and Head, BEDRC, ex-Senior Professor in HOD, MSR Medical College, Bengaluru. Dr. Lijesh KU, Consultant Endocrinologist, Valuvanad Hospital, Palakkad, Kerala. And Dr. S. Geeta Lakshmi, Consultant Endocrinologist, Pragati Endocrine Clinic, Sanatorium, and Dr. Kamakshi Memorial Hospital, Chennai. Thank you so much, doctors, for joining us on this very important issue and something that more people need to be aware about. Dr. Dharmalingam, I'd like to start with you. Most people get diagnosed with pre-diabetes when they're undergoing a regular checkup or being diagnosed with an infection, and then they get this as a nasty surprise and frequently panic as well when they think that it is diabetes. So why is this condition called pre-diabetes, and how is it different from full-blown diabetes?
So thank you very much, Gayatri, for that question. Pre-diabetes is a stage before diabetes. If you look at the glucose, it is a continuum. So the measures that we usually look at is the fasting plasma glucose, which normal is below 99. Between 100 to 125 is pre-diabetes, and more than 126 is frank diabetes. The other parameter that we look at is the 2-hour post-glucose load, that is after a glucose oral tolerance test. So this less than 140 is normal, and 140 to 199 is pre-diabetes or impaired glucose tolerance, and more than 200 is diabetes. So we know that this is a continuum. The other parameter which we use now is the HbA1c, or the glycosylated hemoglobin. This normal is less than 5.6, and 5.7 to 6.4 is pre-diabetes, and more than 6.5 is diabetes. So we know that this is how we classify pre-diabetes. Now, what is the importance of this is, and how is it different, is it's an opportunity for prevention. So if I can diagnose someone at pre-diabetes stage and implement some lifestyle, I can possibly prevent onset of diabetes. So we usually screen children of parents who are diabetic, or if they have any other comorbidities like blood pressure or overweight, we screen our patients. But you should also understand India is very prone for diabetes. So it is recommended that everyone above 30 with a family history should be screened for diabetes. How is it different from diabetes? It has got some similarities also. That means the complications, the major complications start in the stage of pre-diabetes itself. So we are worried that patients should be controlled and reverse back to non-diabetes and not progress to diabetes. And on the other hand, we also call it an opportunity of prevention, especially once we screen or we have gestational diabetes or polycystic ovaries, where we can actually guide them to reverse their diabetes. Do we need to panic? Not at all. I think it is a golden opportunity, and we need to identify people at this stage so that we can prevent the progression of diabetes. Thank you.
All right, Doctor, now let's also talk about when one should go in for those tests. And Dr. Lijesh, a sedentary lifestyle is one of the major causes of prediabetes in most adults. But is there a specific age or group of people who should get tested for prediabetes at regular intervals to detect the condition at an earlier stage and prevent that development of full-blown diabetes?
Thank you so much for that question. Now, of course, a sedentary lifestyle is a major risk factor for developing prediabetes or diabetes mellitus. Now, regarding the screening of prediabetes, recently, US Preventive Task Force had revised their recommendation on screening prediabetes. Accordingly, adults aged 35 to 70 years with overweight or obesity should be screened for prediabetes. So overweight in Indian scenario is a BMI of more than 23 kilogram per meter square. Now coming to the screening interval, there is no specific screening interval mentioned. However, once in 3 years, screening is reasonable. Having said that, certain categories of individuals have high risk for developing diabetes or prediabetes, like those individuals with a strong family history of diabetes, people with obesity, and those who have significant fat over the abdomen, then women with previous history of gestational diabetes mellitus, then those who are born with a low birth weight of less than 2.5 kilograms, and then those individuals who are born to mothers of gestational diabetes mellitus. So these individuals should be screened at a younger age. As Madam Ma'am told, they should be screened from age of at least 30 years. Thank you so much.
All right, Dr. Geeta Lakshmi, what is the correlation between pre-diabetes and insulin resistance? If you could explain, that aspect to us.
Yes. I think that's a very important question because insulin resistance is a main culprit behind prediabetes. So, we all are aware that insulin is a hormone that's produced by our body, which takes care of our sugar levels. So, in patients who are pre-diabetic or diabetic, so this insulin hormone is produced normally by the pancreas, but this hormone is not able to function effectively. This could be due to a number of reasons. They may be genetically predisposed to have this kind of insulin resistance, or they might be overweight. They could just be on the normal weight side, but still have an excess of abdominal fat. So these factors could hamper normal functioning of this insulin hormone. So though it is produced normally, because it is not able to carry out its functions well, the cells are not responding well to this insulin, hence the blood sugars go up. So this is the beginning of the continuous process that is called as prediabetes. So I think this is very important to understand because all lifestyle measures, reducing body weight, reducing abdominal fat, everything is focused on reversing and reducing this insulin resistance, thereby preventing us from becoming pre-diabetic or a diabetic. Thank you.
All right. Now, Dr. Dharmalingam, does pre-diabetes always develop into type 2 diabetes? And if you could tell us more about, about its reversal.
Yes, I think a lot of excitement nowadays about reversal, not only of pre-diabetes, even diabetes. No, not all diabetes convert to, pre-diabetes convert to diabetes, but the conversion rate is pretty high. It's about 70% over a 5-year period. The ones on the higher end of the normals, which I told you, of pre-diabetes, they will convert more quickly to diabetes. But yes, it can be prevented or it can be reversed. So what is the evidence that we have? Some time back, there were some prevention programs which were done called the Diabetes Prevention Program, both in India and abroad, and they categorized people into lifestyle and medications also. And what was interesting was when they took the pre-diabetes persons and put them on an intensive lifestyle of diet and exercise, the reversal rate was as high as 58% compared to even tablet, which was metformin, where the reversal rate was 38%. And interestingly, this was almost uniformly found in studies done all over Europe, Finland as well as in India, that the reversal rate was higher with an intense lifestyle. So yes, it can be reversed, and there is hope for everyone, and that is why screening becomes important.
All right. Now, Dr. Lijesh, if we talk about managing our health and when we have pre-diabetes, if you could tell us what is the best eating plan for somebody with this condition?
Yeah. So the diet plan or the so-called medical nutrition therapy, we should aim at maintaining the nutritional status of the individual, maintain the normal body weight, and delays the development or prevents the development into diabetes mellitus. So we can formulate the diet plan based on the weight of an individual. Accordingly, an obese sedentary individual can consume per day kilocalorie of about 20 kilocalorie per kg per day. Accordingly, if the individual is more active, it can give little more kilocalories per day. And now, other important two aspects are, one is calorie control and second is portion control. Now coming to portion control, just imagine one full plate, out of which a half portion you should give to vegetables and salads. Another half you can equally divide into two, one containing cereals like chapati and rice, another portion with proteins and fat like legumes, dal, then fish, egg whites and chicken, so on. And coming to calorie control, low glycemic index food like whole wheat grains, then brown rice, oats have low glycemic index, which reduces the development of pre-diabetes or progress into diabetes. Also, plenty of high fiber foods like apple, guava should be included in the diet. Also, you should, if you have the habit of alcohol consumption, you should moderate the alcohol consumption. Then sugary juices and sodas should be avoided. And also you should consume at least 2.5 to 3 liters of water per day. So with that, you can control the glucose levels and prevent progression into diabetes mellitus. Thank you.
All right, Dr. Geeta Lakshmi, how long does a person have to make lifestyle changes to reduce the risk of occurrence of diabetes?
So, actually, as already been talking about, diabetes is a lifestyle disease and it's a continuous disease. So, these changes have to be started early and have to be continuous to make a successful prevention of the patient transitioning from diabetes to diabetes. So, in this, we are already concentrating on 3 aspects on prevention. One will be weight reduction, second will be exercise, and the third will be dietary modifications. There's only a specific cutoff for the weight reduction alone. So various studies and evidence have shown that at least 5 to 7% of body weight reduction can definitely help in patients progressing from prediabetes, prevent progression from prediabetes to diabetes. Whereas if you take diet and exercise, it has to be a continuous process. So less of refined carbohydrates, less of processed foods, less of fats, and more of proteins, and at least 30 minutes of exercise every day. So this becomes a healthy lifestyle process, and it should be made a daily habitual activity for every patient to prevent progressing to diabetes.
All right, Dr. Dharmalingam, we've spoken a lot about, the diet and the foods that people who have prediabetes should follow. But should people be more specific and, go into more detail? Should they check the glycemic index of the food that they're consuming and make efforts to consume only low glycemic foods?
Thank you, Gayatri. That's a very interesting question. And yes, people should become much more aware. I think this is a great platform to spread awareness, because glycemic index is comparatively a new term as far as patient education is concerned. So now what is glycemic index? It's a measure. It's a measure of how high a glucose can go post a meal or a food item. So it is usually compared to sugar, and it is graded between 50 to 0 to 100. So if a food item has a glycemic index of less than 50 to 55, we say it is a low glycemic index. And if it is 55 to 70, we say it is moderate glycemic index. And if it is more than 70, the glycemic index, we say it is high glycemic index. Doctor has already mentioned what are the items. So yes, legumes and vegetables, fruits, they have very low glycemic index. Middle glycemic index or moderate glycemic index is found in maybe oatmeal or brown rice, and high glycemic index is found in rice or white bread. So which are things we should allow. We should not be allowing the patient to take, and they should take only low glycemic food. Along with this, a very important parameter is glycemic load. What is this glycemic load? Glycemic load is glycemic index multiplied into the carbohydrate in that meal. So if the glycemic load is also high, then the blood glucose is going to go high. So these are the two things that we are very concerned that patients should know and get aware. So as far as the patients now are concerned, they do know what is caloric diet, what calories they should take, and much we have talked about portions of food, how much carbs, how much protein, how much vegetable. But in the carbs, which are the carbs that they should take, which are healthy for them with low glycemic index, is something that they have to know so that they can be free to consume that in slightly larger quantities. Thank you.
All right, so many important factors to keep in mind when one talks about pre-diabetes and how to manage one's health and prevent it from developing into full-blown diabetes. A lot more questions for you, doctors. We'll slip into a short break now and return with more. Stay with us. Welcome back. We're watching Health and Wellness, Myths versus Facts, and we're talking about pre-diabetes, how you can manage this condition, how it's important to get it detected, and how to prevent it from becoming full-blown diabetes. Let's go across to the doctors now. And Dr. Lijesh, can yoga or meditation help in the management of pre-diabetes?
Yes, that's an important question. Now, before discussing about the aspects of yoga, I would like to brief little bit about the importance of exercise in individuals with pre-diabetes. So, regular exercise improves the glycemic control. It helps to reduce the insulin resistance and maintain the body weight. Regular exercise also helps in reducing dyslipidemia, blood pressure. It also improves the cardiac health in terms of reducing the coronary artery diseases. So what are the types of exercise an individual with pre-diabetes should regularly do? They should follow 4 types of exercises actually. One is resistance training to improve the muscle strength, then aerobic exercises of 30 to 40 minutes daily. Then you should also do flexibility exercises to improve the mobility as well as maintain the muscle tone. And also you should do endurance exercises to improve the cardiorespiratory endurance. Now coming to yoga, which is widely practiced all over India, yoga has the primary advantage that it is very easy to learn and perform. No probes or instruments are needed, and a long-term adherence is noted, is seen. Now, recent studies have shown that continuous practice of yoga improves the glycemic control, reduces dyslipidemia, and certain poses of yoga is known to reduce the blood pressure. Also, yoga reduces the overall stress of an individual, and it also provides a well-being to the individual. So, performing yoga and meditations are good. Also, you should focus on other types of exercises, which I mentioned also. Thank you.
Right. Now, Dr. Mala, are there any extra precautions that people with pre-diabetes and other comorbid conditions such as hypertension and obesity should take?
Yeah, thank you very much, Gargi, for that. The precaution is that we don't know the health of a person. So now we have been discussing that exercise is very good and they should do that. But we also should know what is their stamina, what is their cardiovascular risk before we advise them to do the diet or the exercise. So we need to tell them to do all of these things regularly. Apart from that, if I have pre-diabetes, what should I be careful about? First thing, of course, I'll try to prevent diabetes from coming. The other thing is the continuum, we call it the common soil hypothesis of insulin resistance, is common through the continuum. Even in the stage of pre-diabetes, a person is prone for macrovascular complications like the heart disease or a stroke. Unlike microvascular complications, which is that of the eyes, the kidney, and the gangrene, which does not happen until the diabetes actually starts. So in pre-diabetes, we are worried about their macrovascular health, that is the heart and the stroke. Of course, apart from that, they are more prone for certain problems, so they should get vaccinated regularly, and that could prevent so many of the other problems. What are the vaccines? Simple flu vaccine, hepatitis vaccine, pneumonia vaccine. These are some vaccines that they have to take. And what we have found is, over this COVID pandemic, those who are well controlled, we could prevent major problems in them if their sugars are controlled. So this is something which is important, and even patients with pre-diabetes should not take it casually and should take care of their health to see that they don't get complications and prevent themselves from going into diabetes. Thank you.
All right. Well, let's go across to Dr. Geeta Lakshmi as well. And Dr. Geeta Lakshmi, do people with pre-diabetes get hypoglycemia episodes, and should they then be cautious about hypoglycemia episodes while exercising?
Yes, definitely. See, pre-diabetic patients do get hypoglycemic episodes. Actually, there are two kinds. One, it's very mild, and the other thing about it, usually it comes and goes, but patient never realizes it was actually hypoglycemia, and patient also doesn't realize many a time that this is a thing which can lead on to diabetes in future. So any patient, for that matter, any person, healthy person who has a strong family history of diabetes, and whenever they develop some episodes of giddiness, sweating, and they are unable to tolerate hunger, and they skip a meal or they delay the meal for few hours, and they are not able to tolerate the delay of the meal, they should definitely go and check their blood sugars at that point. And if it is less than 70 milligrams per deciliter, then they should be getting themselves to their physician, diabetologist, and check what it's all about. So many a time these kind of episodes can be an early warning sign that these patients are more prone to diabetes in future. But and these patients can modify their diet and lifestyle. So what they can do is the prior meal what they have should contain less of carbohydrates and more of proteins, because proteins are a kind of meal which promotes satiety. That is, you feel full and it gets digested relatively slow. So because of that, these people will not develop any hypoglycemic episodes. And also these people should be aware that they should always carry snacks. But no, unlike a diabetic, these kind of hypoglycemic episodes are never very severe enough to cause loss of consciousness or to cause a hospitalization. But yes, they do occur, and they are an indicator that healthy lifestyle and diet modification and weight reduction should start from that day on. So it can be a useful warning sign in that aspect.
All right, thank you for that. And Dr. Lijesh, does excessive stress cause pre-diabetes? And you know, these days everybody talks a lot about stress and the detrimental effect it has on the body. And is pre-diabetes also one of the effects?
Yes, of course. This is a very important question, especially on the background of COVID and a lot of stress around. So stress can produce something called as allostatic load, and this allostatic load is causing release of various hormones like glucocorticoids, then epinephrines. Also, it will lead to impaired pancreatic function in terms of beta cell dysfunction. Also, when you consume glucose, there is something called incretin, which is produced from the gut, and there is something called incretin response or glucose-mediated insulin secretion from the pancreas. So none of these functions, aspects, will function properly, and these individuals are prone to develop diabetes or prediabetes. In addition, stress also can lead to insulin resistance, which again can add on to development of prediabetes or to diabetes mellitus. Thank you.
All right, and Dr. Geeta Lakshmi, can pre-diabetes cause foot ulcers? We do know that in diabetes, full-blown diabetes, you do have these issues, but can pre-diabetes also lead to this?
Yes, actually, almost 15% of pre-diabetic patients can have a complication of diabetes called as diabetic neuropathy. So this is a nerve-related damage. So the nerves are getting hurt because of the excess blood sugars that are happening across the bloodstream. So, and because of this, there can be loss of protective sensation in the foot, and then this can lead on to foot ulcers. Though it is not that common, but patients who are having diabetic neuropathy or any loss of sensation of food or any tingling or any numbness of food or any burning sensation of food definitely should get their blood sugars checked. Though they are not diabetic, if they are going to be pre-diabetic, then their blood sugars have to be kept under very, very strict control. So they should follow these lifestyle measures and diet, and if necessary, medications like metformin on a regular basis, so that the blood sugars never fluctuate to the pre-diabetic range as well. So this kind of control and lifestyle measures can definitely prevent this neuropathy complications and the secondary sequelae of that is foot ulcers.
All right. Well, thank you so much, doctors, for talking about this very important issue of pre-diabetes and how it's important to get it checked and detected at the right time so one can take certain steps and make certain life changes so as to reverse the condition. Thank you all for watching at home. Goodbye.